Care Queen Brenda here. So when is it appropriate to seek placement for the hospice patient? For the most part, patients and families appreciate the idea of the hospice patient staying at home, surrounded by loved ones until the end of their life. While this is a beautiful and meaningful goal, it's not always realistic or feasible. Caregiving can become physically, emotionally, and logistically overwhelming, and sometimes the patient's needs exceed what can safely be managed at home. In these cases, alternative care settings can provide the necessary support while still honoring the patient's comfort, dignity, and wishes. Most people don't know just how challenging it can be caring for the hospice patient at home. It can be physically too demanding and lonely. I've seen an 88-year-old wife who weighs 90 pounds trying to care for her 200-pound bedbound husband, and she just can't do it. Another common scenario is if everyone either works or is in school. The Family Care Act does require employers to allow time off for caregiving, but unfortunately, it doesn't always provide paid leave. Many families simply can't afford to take unpaid time off. Please ask your hospice social worker to help you access the Family Care Act through your employer and find out what your benefits are. Then there is the emotional toll of being a caregiver. Not everyone is a natural in this role, and they can even find it traumatizing. Lastly is the lack of safety for both the patient and the caregiver. Some people are straight up and honest that they just can't do it anymore, but others feel guilty and alone and don't ask for help. As part of my general assessment with each visit, I find a safe time and place to ask the primary caregiver, how's it going? How are you coping? Even if they're not showing signs of caregiver burnout or distress. More awareness and support are needed to help families navigate this reality and access available resources. The key is to be honest with yourself, the patient, and everyone involved in the care circle. There is no need and no room for guilt here. We all have to do this the best we can with the reality we face. Choosing a different care setting, accepting help, does not mean you're failing. In fact, when the weight of the hands-on caregiving is lifted, you may find yourself in a more present, more engaged, and able to fully cherish the sweet, meaningful moments that truly matter. Being an advocate and a loving presence is just as important as providing physical care. Ask for help and guidance and try not to wait until you are at your limit. Here, click the link below and you can get a copy of our booklet, The Hospice Care Plan, helping families and caregivers safely and effectively care for the hospice patient.